Mastitis care and management changed in 2023, but it's taking a while for the word to spread. If you're still being told to have a hot shower and a deep massage, this is wrong. So here's a rundown of all of the new and improved advice. What is mastitis? It's an inflammation of the breast and it's suspected to affect up to 20% of breastfeeding mothers. Of course, I've never experienced it personally, but I've seen it and it is no small problem. It can be brutal. Mastitis can feel like you've got the flu, you feel hot, body aches, pains, and then a sore red area on the breast itself. It's complicated, it's a painful condition, and it can often contribute to early cessation of breastfeeding. The new changes debunk the theory of clogged ducts that underpinned previous advice and led to women trying to empty the sore breast by feeding their babies more or by pumping more regularly. Now it's believed that mastitis is caused by a narrowing of the milk ducts that occurs when milk flow is restricted because of surrounding inflammation. And this commonly occurs when too much milk is being produced and not enough being extracted. The lumps that women with mastitis might feel in their breasts are a buildup of fluid linked to this inflammation. Now, thanks to evolving research and understanding, we now have some updated recommendations to help prevent the condition and also encourage it to pass quicker when it does happen. So, let's talk about the new advice in detail. The first recommendation promotes breastfeeding on demand equally on both sides. The old advice in the past, a common approach to dealing with blocked milk ducts was repeating feeding on the affected side. However, recent findings suggest that this can perpetuate the cycle of hyperlactation and actually worsen the inflammation. Now, the second recommendation is to limit the use of breast pumps. The frequency and volume of milk expression have undergone a significant shift in recommendations. The old advice? Well, previously pumping was encouraged to empty the affected breast after a feed, but the new advice is to limit pumping where possible. Only pump if you miss a feed and only pump what your baby would consume normally. The third recommendation is to opt for lymphatic drainage over deep tissue massage. So the old advice was about squeezing and deep tissue massage of the breast. It was recommended in the past to alleviate blockages, but doing this can lead to increased inflammation and potential injury as well. So avoid deep massage or electric toothbrushes, other commercial vibrating massaging devices. The new advice is a gentler approach called manual lymphatic drainage, which involves lightly sweeping the skin. Now, the fourth recommendation is cold over heat. Previously, it was all about heat packs, hot showers. This is what was encouraged, but now it's recommended to do the opposite, to ice and cool to reduce inflammation. Interestingly, there may have been something in the age-old treatment of cold cabbage leaves for mastitis, with the new protocol acknowledging that while cabbage is no more effective than ice, it's the cooling effect, because you take it out of the fridge, that delivers the therapeutic benefits. The fifth recommendation is around antibiotic use. The old advice was if you developed a fever or redness in the chest, they were told to see their doctor immediately, get antibiotics straight away. Now, women are urged to seek medical help if they don't start to feel better within 12 to 24 hours of trying the strategies I just mentioned. The fever and chills that comes with mastitis are now thought to be symptoms of inflammation and not necessarily infection. Over-the-counter medicines like ibuprofen and paracetamol can help with pain relief and also inflammation. Sunflower or soy lecithin, 5 to 10 grams daily by mouth, can be taken to reduce inflammation in the ducts and emulsify the milk too. Antibiotic use is now only recommended when mastitis transitions to bacterial mastitis, which can certainly happen, but not as often as previously thought. If you're experiencing any difficulties or you've got concerns, please consult with a healthcare professional who can provide personalized guidance and support.